In this 11th number of the newsletter of the Italian Sociological Association, Sociology of Health and Medicine, we have the pleasure today to interview Jonathan Gay. Thank you very much. He's Emeritus Professor of Sociology in the School of Law and Social Science of the Royal Holloway, University of London. Chair of the European Sociological Association Research Network 16, Sociology of Health and Illness, between 2015 and 2019. So, John, this morning we would like to talk about the concept of pharmaceuticalization that has represented a remarkable contribution to the sociology of health and medicine. Could you please briefly present its main elements, and could you please help us to highlight how it can now contribute to the analysis of a post-pandemic or syndemic society? Thank you.
Thank you, Angela. I've been involved in pharmaceuticals and pharmaceuticalization for a long time. I was working with colleagues around 2011, and we came up with this concept of pharmaceuticalization. These colleagues were Simon Williams and Paul Martin. What we wanted to reflect was really the growing power of the pharmaceutical industry, a recognition of the growth of pharmaceuticals since the 1980s. Medicalization has traditionally been seen as a concept which can capture such developments. However, we felt there was a need for a new concept to reflect the growing power of the pharmaceutical industry and the possibility of pharmaceuticalization without medicalization. Medicalization, of course, is the process whereby non-medical issues become defined and treated as medical problems, usually in terms of an illness or disorder. But we wanted to emphasize the way in which pharmaceuticals and pharmaceuticalization can take place without medicalization. For example, when people buy drugs over the internet without any direct involvement with a doctor. So this definition is concerned with the transformation of the human condition, the capabilities, turning capabilities into opportunities for pharmaceutical intervention. It extends beyond the realm of the strictly medical. The non-medical use of pharmaceuticals for lifestyle enhancement amongst healthy people is a key aspect of this. It's important to recognize that the term is value neutral as far as we're concerned, with gains and as well as losses. But whether it actually occurs is an empirical question which needs to be researched. One of the dimensions that we looked at when developing this concept were changing forms of governance, particularly during the process of globalization, changing relationships between regulators and the pharmaceutical industry, particularly recognizing the reforms that reduce the regulatory hurdle and increase the dependence of regulators on industry, and policies to increase the role of regulators in promoting drug innovation. To illustrate this, I want to focus on recent developments with regard to the pandemic and the role of pharmaceuticals in this, particularly the focus on vaccine development. One of the things which has been so significant during the pandemic was the speed at which vaccines were developed, less than a year from the pandemic being declared. So we had companies like Pfizer and BioNTech working together, were one of the first to develop a vaccine with new technology, so-called mRNA, and others followed. Normally, it takes 10 years to develop a vaccine, but in this case, as I said, it took less than 1 year. One of the reasons why they was so successful in developing this vaccine so quickly was that the regulators waived the demand for phase 3 trial results before giving approval for the vaccine to be rolled out. And at the same time, there was an acceptance of the role of interim data. So what you had with the pharmaceutical companies providing data on an ongoing basis to the regulators, and this also speed up the process. So this, in addition, was held by governments providing financial support for the development of vaccine, and also philanthropists such as the Bill Gates and Melinda Gates Foundation. This was particularly important because it provided a lot of financial support and encouraged the pharmaceutical companies to take the risk. One of the consequences of this then was the vaccine was rolled out, and we might look at this as an example of good pharmaceuticalization in the sense it provided much needed help in fighting the pandemic and in a sense opening up society again as a result of the pandemic being tackled through vaccines. But the important point I want to emphasize is the role of regulators in this process and their willingness to allow vaccines to come onto the market at a relatively early stage and not go through the whole regulatory process as we would normally expect. So what we have here then is an example of so-called good pharmaceuticalization in the sense that public health was definitely helped by the development of vaccines, but at the same time, we have a continuing example of profit maximization because some of these companies are and will make a huge amount of money from vaccine development, investing, for example, around 3 billion in the case of one company and generating profits in year one of over 30 billion. So you can see the amount of money to be made. So I would argue that pharmaceuticals in pandemic times provides yet another good example of the power of pharmaceutical companies. Thank you very much.